Dr. Luttrull, thank you so much for meeting with us at the ASTROS 2017 meeting. You had a presentation about the reduced risk of choroidal neovascularization following subthreshold diode micropulse laser. Can you tell us a little bit about your presentation? What were the main points of your findings there?
Well, we describe a large group of patients with a very high risk dry macular degeneration, which means that their risk of progressing to wet AMD is extremely high by virtue of their age and clinical findings. In the ARID study, for example, the median age was 69 years old, and no patients were over 80. In our study, the median age was 84 years old, 15 years older than the ARID study, and 67% of the patients were over 80. So it's a very high-risk group. What we found was that regular treatment utilizing SDM laser dramatically reduced the incidence of CNV, or wet AMD, that one would expect. SDM laser is a specific type of micropulse laser that's designed to be reliably harmless to the retina and at the same time effective. What it does is it stimulates a physiologic repair mechanism in the retina that reverses the damage of chronic progressive retinopathies. A year or so ago, we published a paper showing that SDM improves electrophysiology and visual function in patients with dry AMD. Usually in medicine, whether it's your heart disease or renal disease or anything else, if you can improve function of the organ, you should reduce the risk of progressive disease and bad events like heart attacks or visual loss. And so by showing that we were significantly improving both retinal and visual function, we were hoping that we would see a decreased risk of vision loss down the road. So after a period of time, decided to look at that and look at the incidence of choroidal neovascularization after SDM. And what we found was it was very low. In an average follow-up of almost 2 years, with 547 eyes of 354 patients, we found that the CNV incidence after treatment was less than 1%. If we compare that to the ARID study, without adjusting for any risk factors, that is an 80% reduction in the risk of the expected incidence of choroidal neovascularization. If we try to adjust for the very, very high risk factors of this study group, simply by adjusting for age, we find that the reduction in the expected rate of choroidal neovascularization in this group was between 93 and 98%. So what we have been able to show at this point is that the treatment is, as we knew before, extraordinarily safe. There are no known adverse treatment effects in almost 20 years of clinical use, nor in this study, and that it worked as we anticipated, only far better than we anticipated. We expected it would probably reduce the incidence of choroidal neovascularization. We're frankly a bit surprised it did so this much. Now this is not a randomized clinical trial. It's data from my electronic medical records office and my practice. It's a retrospective study. So like any retrospective study, it proves nothing. It has to be validated in a randomized clinical trial. But it certainly suggests that those kind of trials need to be done, because if we can confirm these results, this would be a game-changing progress in the management of dry macular degeneration, significantly altering our management and our expectations for these patients.
And given the findings that you had with your retrospective study, is there anything you would say to specialists in treating their patients with AMD while they're maybe waiting for some more clinical trials to take off for this?
Well, I would just simply caution them that once again, this is a retrospective trial. It certainly reflects the success I've had with it in my practice, although I developed the technique many years ago and I have far more experience than anybody with it. It's like anything else, it needs to be done correctly and carefully. But I have no reason to believe that done in the same way that it was done in this study, it shouldn't work elsewhere.